So many people were asking me, like I have medicine as a branch, who should take medicine? So this is a very difficult question. Most of the PG aspirants and INI PG when they give, so they'll be very confused which branch to take, whether to take pediatrics, whether to take medicine. So most of them will have a very good clarity regarding whether to take a surgical branch or medicine branch. But among medicine branch, they will be having confusion. This whether to take radio and medicine, very confusion, and whether to take dermat and medicine, or whether to take pediatric versus medicine. So who should take medicine? So I'll give a very good clarity regarding who will this branch fit into. Okay. So first we'll speak with the advantage and disadvantage, and we'll finally decide who should take. So, like speaking about advantage, medicine has a lot of wide variety of cases. So, what I say is this is the only branch among all the branches where you get to see a unlimited variety. You can see a like lot of different cases, and it's ever interesting. So you'll always be guessing like what is going to be this case, what is going to be the case. And it's not a textbook presentations, all the cases. Most of the cases will come in a very different history, different clinical say, like science and examination findings. So it's always interesting. So this is one of the biggest positive as per me. So people like who are very like thrill seeking, who get bored very fast, and who likes to think, uh, who wants to see a lot of different cases should go for medicine. And like in medicine you see a lot of different cases in CNS diseases, CVS diseases, gastrointestinal diseases, respiratory diseases, rheumatic diseases, endocrine diseases, oncological disorders. So like wide variety of cases you can see. Now second advantage, if we speak about, it's regarding you don't need a large expenses per setup. So post MD you need just a stethoscope where you can immediately start the practice. You don't have to like wait for a lot of like setup. So that's a very big advantage, because other branches like probably like a surgery, you need some surgical setup, so that's going to be very expensive. But medicine is not like that. You don't need any particular expensive setup. Then the third thing is like wide variety of jobs. Post MD you can work in ICUs, okay, you can work in clinics, you can like do jobs in nursing homes, or you can join corporates, you can join medical colleges. So there are plenty of jobs. That's why we call it as like a king of the branches. You don't have to worry about the job loss, so you will find one or the other jobs. This is one of the biggest advantage as per me. So these are the main advantages. So let's speak about disadvantage. So number one disadvantage as per me is it's a lot of hectic branch. So in PG 3 years you will have to slog a lot and lot. You will have to do a continuous 36, 40, 45, 50 hours of duties, continuous 3 days of duties. So a lot of workload will be there. So if you are able to handle that much, then you have to take, or else it's not a easy branch. You will have a lot of stress, you will go through a lot of difficulties. So it will all like make you very strong at time, but in future life it's going to be very very hectic. Second thing, second disadvantage or advantage could be it's a since it's a clinical branch involving a lot of patient interaction, you will have to put a lot of efforts, okay, speaking with the patients, speaking with the patients parties, convincing them. So a lot of extrovertedness also kind of needed in this branch. So for an introvert, this could be a little bit disadvantage. Now, then other second disadvantage is like difficulty in getting the seats. MD medicine, to get an MD medicine, you need a very high rank. So extreme competition is there. Most of them want to go for MD medicine. So lot of difficulty in getting a seat. So lot of competition is there to get a very high rank, probably like 4,000 all India. If you get a, you might get family medicine, that in periphery. So within 2000 you might get a good seat. So this is the second disadvantage. Now third one is post PG. Also you will have a lot of difficulties like hectic work life. So since you will admit a lot of patients, so you will have to counsel them, you will have to see them in the nights, you will have to do the rounds. If something goes wrong, they'll blame you, so you have to take some more responsibilities. So this is also one of the disadvantage. So overall, if you consider both advantage and disadvantage, this is a branch which is suitable for people who are who are into seeing a lot of different cases, variety of cases, who are willing to work hard, and who are willing to put themselves in the field, speaking with the patients, convincing them, treating the patients. So this is the ideal branch. So if you are that kind of person, or if you are able to work a lot, so definitely it's your branch, and this is going to be very fruitful in the end. And one more disadvantage I left it. So this is like whether to be an MD or like to go for super specialty. So this is up to you. Definitely super specialty has a own advantage compared to just medicine. So if you want to specialize in a one subject, you can go for that. So there's one more exam again you have to read and write. So that is also, I think, it's a disadvantage. So these are all the advantage and disadvantage. Overall, MD medicine is like a king of the branches. So if you are willing to put yourself out there, work hard, and study a lot, this is your ideal branch, and it's going to give you good money and good satisfaction also. So all the best.